Welcome back. Welcome back. This is the People's Voice. I am Trey Evans, and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we thank everyone who has taken some time to listen to the podcast today. We do understand that you could be utilizing your time to do something else. So we are appreciative that you're taking that time to spend with us. As always, if this information is valuable and you find this to be enlightening or worth sharing, we ask that you subscribe to the podcast and turn on notifications. That way you can be notified when each episode is released. And we do put out a new episode each and every Friday, which is heard on all podcast platforms. And then we put a video out on YouTube as well for those who like to watch the podcast. But in any event, as always, we say welcome and welcome to the People's Voice podcast. So today I want to talk about, I don't know why I just did that accent. Today I want to cover pharmacy closings in the United States. There has been a rash of closings of pharmacies here in the last, well, definitely in the last year, but this has been something that's been ongoing for well over a decade now. And so I want to talk about that today. I want to talk about obviously what's causing this issue. Talk about a little bit of who this is going to affect, and then also what is being done about it to address the issue. So that's what I want to talk about today: the closing of pharmacies here in the United States. And I want to talk about this because I came across a story a few days ago that was on Fox Business. And in the story, they talked about the headline says pharmacy chain closing 114 stores across multiple states. And I was like, well, that's wow. I'm like, again, like what's happening this time? Because I know I just read a story about CVS or maybe Walgreens, one of them just closing. But in the story, they talk about Rite Aid. And basically in the story, it goes on to say that Rite Aid is in the process or in the middle of a bankruptcy filing. And actually, this is their second bankruptcy filing in the last 2 years. And it's as a part of that bankruptcy process, they are closing 114 stores. And this is not, again, this is not something that has just started to occur. This has been occurring, well over a year and change. But the story caught my attention because what I wanted to find out was, okay, why are they closing, right? Because, stores close all the time. And initially I thought, it's probably got to do with the amount of shoplifting that's going on, because unless you're living under a rock, you know that these stores, all of these retail stores are being hit literally on a daily basis, which has contributed to some of these stores closing as well. But I said, there's got to be something else going on. In any event, did a little bit of research and came across the fact that these stores are closing not just because of theft, and not just because Amazon has taken over the world, but these stores are also closing because of a process that's in place here in the United States in terms of the drug delivery and manufacturing process that ultimately these stores are responsible for distributing to patients. So that's what I want to talk about today. I want to delve into that process, what that process is. And then, like I said before, kind of talk a little bit more about, who this is going to affect and what's being done. So the process that occurs here in the United States is managed by what they call pharmacy benefit managers. And pharmacy benefit managers essentially are middlemen. They are responsible for negotiating rates between health insurance companies, drug manufacturers, and pharmacies as well. And one of the problems that is occurring, especially at the pharmacy level, is that these pharmacy benefit managers are responsible for setting reimbursement rates that pharmacies receive for filling prescriptions. And what is occurring, or what's being argued by many pharmacies, is that these reimbursement rates are just too low, and it's not allowing many of these pharmacies to stay profitable. Matter of fact, there was a story about this on PBS, and they talked about this. So let me play this from this is from PBS. They just talked about this, where they were highlighting a number of independent pharmacies that were in Wisconsin, and many of them went to the legislature there in Wisconsin to talk about this issue, because they're trying to put legislation together to address ultimately what's going on with these pharmacy benefit managers and how these reimbursement rates are being negotiated. So let me play this from PBS, and then we'll continue from there. So,
biggest of all for pharmacies.
What they will reimburse the pharmacy.
Reimbursing the price of medications below cost.
And when they'll pay the pharmacy.
Forcing them to take losses. At a Senate Health Committee hearing, numerous local pharmacies attested to this issue.
So that my pharmacy is currently operating in the red right now, solely due to PBM reimbursement rates.
Margins estimated to PBMs have increased by 46%, and during the same time, margins to pharmacies have decreased by 47%.
The contracts have become basically take it or leave it. They've continued to erode year after year after year. And it's estimated that independent pharmacies, depending on your particular location in the country, can have anywhere from 20 to 40% of their claims are actually reimbursed below cost.
And no business can run at those type of margins. I mean, it's just, I mean,
men lie, women lie, the numbers don't.
So when we start looking at why are these pharmacies closing, this is a major reason why this is closing. And now keep in mind that piece that I just played, these are from independent pharmacies that are dealing with this. So now when you start talking about national chains that have, 1,500, 2,000 stores, and you start to multiply those low reimbursement rates by that amount of stores and operational costs and things of that nature, you now can kind of get a snapshot into what's going on. Now, the pharmacy benefit manager model is, again, unique to the United States. First of all, it is something that is unique to the United States. No other country, at least from what I've researched, is currently utilizing this model, which is why many people argue that is the cause of why drug prices are so high here in the United States, because I'm sure and you've heard stories of people going over to Mexico, up to Canada to get various drugs for various ailments, and coming back and saying I paid thousands of dollars cheaper than what they were going to charge me here in the United States. And a lot of it again has to do with this PBM model, which is essentially utilizing these pharmacy benefit managers as middlemen. Now, coincidentally enough, here in the United States, this PBM model is basically controlled by three, what they call, again, pharmacy benefit managers. So 3 companies ultimately control about 80% of this process, of this prescription filling process. Those 3 companies are CVS Health, which is the parent company of CVS, those stores, and then also Caremark. Caremark is the actual pharmacy benefit manager. And, CVS Health controls about 33% of that market. Then you have a Cigna, which, yes, Cigna, the insurance company, also controls about 24%. And their pharmacy benefit manager company is called Express Scripts. And then last but not least, you have United Health, which owns what they call what is called Optimum RX, which I believe is the mail or internet delivery service. So 3 companies are controlling
Men lie, women lie. The numbers don't.
this process. And coincidentally enough, CVS, that is one of these companies that has this, that owns this pharmacy benefit manager, also is responsible for charging the local retail CVS pharmacies or not reimbursing them properly, which has caused many of these CVS local retail stores to go out of business. So it's just an insane process. Now, how is this happening, or what happens in this process? So I came across another video on YouTube. This is from a YouTube channel called Stat, and they kind of broke down basically what happens in terms of the drug pricing and how these pharmacy benefit managers, these PBMs, are being reimbursed, and why the price is being driven up to the point that these pharmacies, when they purchase these drugs to sell, they are not being properly compensated. So let me play this from Stat, how they explain this process of how drugs are priced. And this should give a little bit more clarity onto what the issue is. And then I'll talk about what's being done in terms of reforms and then close out from there.
Drugs. One of the ways PBMs influence drug cost is by creating formularies. A formulary is a list of drugs an insurance company will cover. These lists are tiered, typically with cheaper drugs in tiers 1 and 2 and more expensive drugs in tiers 3 and 4. If 2 different drugs pretty much work the same, insurance companies will likely put the cheaper drug on the lower tier. Insurance covers more of the cost of the lower tier drugs, and thus consumers pay less for them. Drug makers want their medicines in tiers 1 or 2. Because they're available to the most patients, they'll make the most sales. But how do they get their drugs in these tiers? They can offer the PBM a rebate or money back on a drug, which makes the drug cheaper for the insurance plan and moves it up on the formulary. So whenever a patient buys a drug in the top tiers, the PBM gets a rebate. The more expensive the list price of the drug, the higher the PBM's rebate tends to be.
And part of the problem there is that rebate, and this is what's being argued, that rebate is not being passed on in full to the insurance companies, and it's definitely not going to the reimbursement rates of the pharmacies, right? So ultimately, the PBM negotiates with the drug maker that they're going to, they're going to charge $1,500 for a drug, and the drug maker says, "Well, okay, we'll give back a rebate of $500, right? Because we want this drug to be placed on tier 1 or tier 2 because we want to sell as many of these as we can." Instead of that PBM taking that rebate and giving it to the insurance company, which ultimately will help lower the amount that needs to be paid by you, and then also taking part of that rebate and reimbursing the pharmacies for the proper amount, they're pocketing that. And then in addition, what they're doing is then they're charging reimbursing the pharmacy for a lower rate, which ultimately is forcing many of these pharmacies out of business. So this is a nasty business. And what is at stake are people themselves, because when these pharmacies close, often those who are immediately affected by this are those who are in vulnerable populations, right? Lower income, those who are people of color, obviously those who are on Medicaid, and Medicare, and public health insurance, things of that nature, because ultimately what ends up happening is that you start to create these pharmacy deserts, just like I've talked about before on the podcast about food deserts. Now you have these pharmacy deserts because the local Rite Aid is now closed. The local CVS is now closed, and Walgreens, and definitely the independent pharmacies once you start to get out into more rural areas of the country. So the trickle down effect of this is massive. And what's going to end up happening is that you're going to see more and more cases of not only chronic illness not being treated, but also access to needed medicine, becoming even more expensive, especially because now you have to find different ways to try to access this. Last but not least, in terms of what's being done, so there has been some reforms put forth to try to address this. Matter of fact, I was reading an article here from the Center for what was this? The Center for American Progress, CAP, literally CAP. And they talked about some of the reforms that were being introduced to try to address this. One of those things is that they want PBMs to be more transparent in terms of what they are receiving in terms of the rebate, because these rebates are not known to the general public and definitely not to other individuals about how much of a rebate are these PBMs receiving from these drug manufacturers when they negotiate these rates. And rebates, just in case anyone's confused about it, it's just refund. What that refund amount is once they negotiate these rates with these drug manufacturers. Now, keep in mind, these PBMs also already get paid a fee to negotiate, to do all of this work. So, what they receive in terms of these rebates is in addition to. So this is, pocket money. Basically, this is couch money, that they are receiving. These stores closing, these retail pharmacy chains closing is not just because sales are sluggish, right? There's a bigger issue at play, and it has to be addressed because literally this is a matter of life and death. Now, I'm not in any way here to give medical advice. This is not a medical podcast. But we all know individuals who are dealing with some type of health issue, and access to medication is sometimes necessary in order for survival. So this has to be addressed. And the best way to address this is by getting in touch with local, state, legislatures to put this on their radar as well, because something has to be done, because if not, what you're going to continue to see is an increase in cost of medicines and then a lack of access to those who need it the most. So I hope this message gets out and we get this moving. Share this as much as you can. And of course, if you want to leave a comment, you can reach me at the People's Voice Podcast on Instagram. You could also leave a message or leave a comment at I Am Trey Evans, which is the YouTube channel. When I post a video, we could discuss it there as well. But that's my time for today. Hope all this information was valuable. But as always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute.